just to summarise what I sort of saw picked up today is that there are a lot of positives and there are still a lot of concerns. Some of the positives are is that families and carers are more included, that they hadn't been before, and it seems to be very closely linked with the Stokes report, which should hopefully give carers more recognition. Some of the concerns is that the notifiable events, although that's a really positive step in the bill, we probably need that list that Jackie was pointing out, and Sandy as well. Sandy. Sorry, Sandy raised it, or Jackie raised it. Sandy, you have it done already, so that will be really good. We look forward to seeing that. And did you say that was on your website?
No, it'll be in our submissions when they're loaded on our website, which I hope to have up at the end of next week. But we're on Twitter, we're on the email, we're on the website, so we'll let you know when it's up.
That would be good if we could have that list of notifiable events, because some of the concerns that were raised, if you have that list, then you know what your rights are, and then you can raise those concerns. So that what I'm hearing is that although there's a lot of concerns, there were some solutions as well, which was really good to hear. The concern over the psychiatrist being able to override things, again, I think if you had the notifiable events and the regulations that the Mental Health Commission are going to publish and put out for consultation, that will also help. And maybe we could look again at looking at the regulations and having people in and having a consultation again on those. The concern that there were no consequences, I found that one quite interesting, and a lot of solutions again about what were the options to have, and I think that still is a concern about how we make sure clinicians adhere to the bill, and that you do need some form of consequences. Public slang, for what better word, is an option, but is it enough? And I'm not personally convinced that is enough. When I did go into the APRA, yeah. There's also the clinical guidelines that hopefully will be user friendly, and did I hear right that they will be similar to the small book that is already available?
I think there'll be a very big set and a number of smaller documents which go to different audiences.
So that carers can also have, so there's 3 documents that carers can have that will be able to give them a better understanding of what their rights are, but also the person they care for's rights. Also, a big concern was about solitary confinement and about the need to take care of making sure that someone was informed, but also that there needs to be legislation or regulations, strict regulations, to make sure that the advocates are in there as soon as possible so that person isn't left isolated. But also, and just sort of finally at the end there, that there was a lot of concerns about people ending up in prison, not having proper treatment, and that the bill maybe just doesn't do enough to do that, and that there needs to be legislation to address that issue. There was a lot of things that were coming up for carers, but I think that those 3 documents, if we can get those, that will address most of those. I'd like to thank everyone for their questions, and I think that went really well, and thank the panel for coming in today and taking their time.